So November is National Diabetes Awareness Month, and more than 2 million people in Florida have been diagnosed with a chronic disease. The American Diabetes Association, it calls diabetes an epidemic here in our country. So it's one with also serious consequences, as you know, making our response important for so many people. And I want to bring in our panel now to discuss how we deal with diabetes here in Florida. So today, joined by Congressman Darren Soto, a Democrat from House District 9. Congressman, welcome back to In Focus. And Dr. Rema Gupta, physician advisor and endocrinologist with Central Florida Healthcare. Doctor, welcome. And Tony Gustaitis, an advanced practice registered nurse and APRN with Advent Health's Diabetes Institute. Welcome to In Focus, Tony, and panel. Thank you. And Congressman, first of all, if I may, what is it that makes helping people with diabetes such an important priority for you personally?
Well, first of all, we see Florida, as you mentioned, over 2 million folks who have diabetes. We see young kids with type 1 that get it from birth, and it's really critical that we have access for them through a lot of the new medications they can wear on their arm. Also with type 2, a lot of our older folks, we have those Caribbean diets and Southern diets that can be tough for diabetes. And so making sure we have low cost insulin, which we capped for seniors under the IRA, is very important, as well as making sure that we have access to exercise and healthy foods, as well as trainers and even GLP-1 medications that are coming onto the market. So there's a lot of things we could do to help these families.
And for you, doctor, we mentioned at the top the estimate that 2 million Floridians, so more than 10% of the state's adult population, have been diagnosed with diabetes. But we also have to remember that there are likely thousands more who have diabetes right now, but they don't know it yet. So what does that say about the importance of, awareness, doctor?
So thanks for having me, Allison. Great point. So one of the main things actually that we can focus on is prevention. So we have a large proportion of patients who have pre-diabetes as well as gestational diabetes. So pre-diabetes many times is referred to for lay people as borderline sugar, but we really need to be labeling it as pre-diabetes because we can make an intervention. And gestational diabetes is essentially diabetes when a patient is pregnant. And we know as physicians and clinicians that both those categories of patients are at much higher risk for developing diabetes. So we have an opportunity there for intervention that is massive. And we need to put a lot of resources towards those two populations that I just mentioned.
Congressman, then, what kind of efforts do you see at the federal level to promote that healthcare access?
Well, first of all, we're in a fight right now in Washington over extending the Obamacare tax credits. We have the second most Obamacare of any district in the nation. So getting that fixed before the end of the year, with Florida having 4.6 million Floridians getting their healthcare through ACA, to make sure they have insurance to cover things like doctor visits, primary care visits, and being able to cover different healthy programs for exercise and physical trainers and things like that. Health insurance is a key battle that we're working on right now. And of course, with those pre-diabetes populations that we hear from our panelists on, exercise, good diet, among many other things like different medications can help to limit getting into that full-blown diabetes scenario where many more co-maladies end up happening, comorbidities.
Mm-hmm. Yeah, so Tony, to you, speaking of solutions, a big issue for many Floridians living with diabetes is the cost of drugs. So what do you see in terms of patients struggling with these costs, and what kind of steps are you taking to help?
Thank you, Allison. Yeah, and to your point, the cost of medication can very much be a limiting factor. We do have a lot of great options available to us, but unfortunately, if our patients cannot afford them, and it's not cost effective, we can't always provide uh, that for them. So we really try to get creative in some instances to see what we can offer patients from a community standpoint in terms of focusing on things that they might have control of, in terms of nutrition and exercise programs.
Indeed, indeed. And doctor, speaking of the cost effectiveness, have you seen movement on that front in recent years?
So we definitely have actually. So there's been some progress, although much more needs to be made. So one of the services out there that a lot of patients don't know about and maybe underutilized, which we at Central Florida Healthcare really offer to our patients, is the pharmacy services. So our pharmacists play a large role in our patient care team. And they're able to help us in terms of applying for patient assistance programs. In terms of patients who are uninsured but have an income, we have sliding scale fees available to offer medications at lower cost to them. Another service that sometimes a lot of patients don't know about and is underutilized is actually through our health department. There's an ability to apply for like an insulin distribution program. So, for example, applications are available, and it's a safety net where requirements have to be met in terms of income, residency. But those are other things out there that can help patients who fall through the cracks. So there's been improvement, but we have a lot left to do. And to Congressman's point, the concern is as the subsidies decline, we will need to have more services available for our underserved population.
And Congressman, you'd mentioned caps. So we saw legislation under the Biden administration, for example, capping the monthly out-of-pocket costs for insulin. I believe it was $35. What's up with that? Do you think that has helped? Is there more to be done? What's this climate of that right now?
So under the Inflation Reduction Act, we were able to cap insulin at $35 a month for Medicare, so for seniors. And we saw a lot of companies at that time also cap it for the rest of the population. But those prices have started to creep up. And so I believe we need to cap it for the whole population. This is something you have to take every week, every day, every month with diabetes, depending on the type you have. And so we need to make sure it's affordable for folks. In addition, as was mentioned, the 340B program helps out with all of our federally qualified health clinics to make sure they can dispense things like insulin and other drugs to help with diabetes prevention at a lower cost for those in need. And so that's a program we continue to defend in Washington. And then finally, Obamacare. This is the big issue. And then we will see Medicaid cuts, unfortunately, over the next year or so of 10 to 15% through the big ugly law that just passed. And so Florida's going to have to grapple with that as well. And when you have less insurance, you don't have access to all these different solutions. And so people with diabetes in particular, given their health conditions, suffer the most.
So Tony from Advent Health, the costs of diabetes, like any other illness, are felt the most by seniors and people who are uninsured. Florida has a higher than average rate of both seniors and the uninsured. So what kind of signal does that send in terms of perhaps urgency for us to tackle this issue here in our state?
I think you made some very good points there. Florida is unique in that we do have a large senior population, which we do know a lot of medications come with potential side effects that our elderly population may be more sensitive to, and a lot of those medications tend to be the generic brands that are the generics that are most cost effective, but can be in some cases the most dangerous for that population. So it's a fine line to walk sometimes when you have to make decisions with patients based on our clinical guidelines that might recommend avoiding or limiting some of those medications if those medications are in fact the ones that they can afford.
And on that note, doctor, we're talking about helping people afford the medications they need to control their diabetes. And we have seen an uptick in use of GLP-1 medications, which treat diabetes for weight loss purposes. How has that impacted the availability and cost of those same meds for the people who need them for diabetes?
So that's actually one of the great things that we've seen in our time is that we have these medications available that can control diabetes, control weight, help prevent the decline in kidney function, and help with heart failure and heart disease. So to have medications that can tackle all four of those things that I just mentioned is game changing. And yes, it had limited availability for quite some time. I think we now are on the other end of that cycle, and I've definitely seen an improvement. But it really is a true testament to science and evidence based medicine that we have these new medications available for our patients.
And so to you, Congressman, just a deeper dive into what we touched upon, what about other costs like insulin monitors or the like? Are there legislative efforts to help with prices there?
So first of all, with the GLP-1s, those should be negotiated through the Inflation Reduction Act. The top 10 most expensive medications get negotiated now by Medicare each year, so that should help out. And it also is critical with this Obamacare fight because once you're on GLP-1s, you need to stay on them normally in order to continue to reap the benefits of that stable weight loss. And so if you don't have health insurance, you're paying out of pocket over and over and over, and it could be hard to sustain. In addition, health insurance allows for people to have access to physical therapy and other things that may help them with healthy lifestyles. And of course, it's also important with diet. There also, we need to continue to work on ways to help out with dialysis for folks who should need that, among other things that I'm on bills to lower costs related to that too. That's more long term. But insurance is the biggest part because if you're uninsured, this could be cost prohibitive, and then people get sick and they die. So it's a high stakes issue to make sure we don't see 100,000 people in Florida's 9th congressional district and 2 million people in Florida lose their health insurance if we don't get these subsidies for Obamacare extended.
And panel, on another note, type 2 diabetes can also be a result of lifestyle factors, which is to say that a whole array of other factors can play a role. So cost of things like healthy foods at the grocery store, maybe gym access, for example. And that means low and middle income communities may be more deeply affected. So Tony, to you, how do we help there? And how do we get healthcare and government to see that and to perhaps collab, to work together?
Yeah, you bring up a great point. It really is a lot about access, and we know that in some communities that don't have even the basic infrastructure where they feel safe to utilize, some of those resources. For example, playgrounds, parks. Do we have sidewalks that we feel safe lighting to walk under? So it is a challenge to try and bring together, organizations like Advent Health. We try to extend to the community, but a lot of it, there is overlap to try and see what barriers we have for some of these communities and some of our patients to see how we can make access a little easier for them.
And doctor, to close out this block, the effects of diabetes, they aren't just felt by people who have the illness. They're also felt by loved ones, families, friends. Are there changes to be made to support those people as well?
That's a great point. So the social disparities in our healthcare is one of the biggest challenges. So in terms of supporting the family, providing bilingual registered dietitians as part of a team, whoever's managing the diabetes, is critical. The medications we mentioned, regardless of how powerful they are, will not do the job on their own. So, providing nutrition services as part of a team approach, as well as mental health services for a team approach for our patients, their family members, their caregivers, is key to success in treating the epidemic that we're seeing in our country.
So, Congressman Soto, Americans' health, you would expect to be a somewhat bipartisan issue. Obviously, lawmakers have different views on how to handle the broader healthcare market, but is this something you've been able to work across the political aisle on?
So on some issues that are more minor, like helping out with access to dialysis, we're seeing some bipartisan support. But right now with the ACA extension, it is a big fight. And as we talked about, without access to health insurance, a lot of these other things you need, from medications to treatments, we won't have without extending and making sure employer-based health care is affordable and Medicare Advantage and Medicare is affordable. In addition, I do appreciate the lifestyle discussion that we've had today. A lot of our local communities, from Celebration to South Downtown, from Kissimmee to St. Cloud, are working on walkable communities, downtowns where people can be more healthy and be more active. And so that's something we have to continue to work on in Central Florida, an area that is very spread out, built after the automobile. So healthy lifestyles, walkable communities are going to be also part of this solution. And that can definitely be bipartisan.
Indeed. Indeed. And Dr. Gupta, what kind of support do you see on the healthcare side coming from the state and federal government? I mean, you have a congressman here with you on the show. So are there additional steps or programs that you would like to see get funded if you had a wish list to ask him right now?
So definitely bilingual registered dietitians for all endocrinologists and centers treating patients with diabetes. Medications are only part of the solution. And in addition, collaboration required from large established diabetes centers with areas that are underserved. So when I say collaboration, referring to places that have the resources to have nutritionists, endocrinologists, pharmacists, behavioral health, and access to research. Have those centers that are already established collaborate with areas that may be underserved. And we're already starting to do that, and we're seeing it. But things like that coming from the state government level is definitely a step to take to help us battle and achieve success in this epidemic.
And to you, Tony, for National Diabetes Awareness Month, bring us home here. What do you think should be the biggest takeaway, both for people living with diabetes and just for viewers at large here?
Yeah, and I think, Dr. Gupta, you make some great points. I just wanted to say I'm nodding my head along with all you're saying. But I think the big takeaway is we need to focus in on one, screening. Screening is probably one of the most important things because the last thing we want to see is somebody showing up in the emergency room, with a very high blood sugar level in a dangerous environment that could potentially cause heart damage. But where I was going with this is if we're able to start from a younger age, letting our children, their parents, their grandparents, having those conversations and educating on what to look out for, what are potential symptoms that could present with diabetes. But I think screening and education is really the foundation that we can really impart in our local communities.
Well, Tony, Dr. Gupta, Congressman Soto, I hope this show provides some inspiration and hope for those watching today. And I can't thank you enough for your expertise and your time here on the show.
Thanks for watching our YouTube channel. To keep up with important issues impacting our communities and hear more conversations with the people who are shaping the future, subscribe to our channel. You can also download our app or find Spectrum News on your TV for balanced, in-depth political coverage and more.